We asked Albertans to step into the experiences of health professionals who deal with extreme workloads, chronic short staffing, and severe burnout, who experience the moral distress of not being able to deliver the high quality care that Albertans deserve, who work in a system that is stretched to its limits and operating within a global competition for healthcare workers. We asked Albertans to send a message to our members, and they answered that call. We received more than 1,000 messages in the first day alone, and hundreds more every day since. These paper shoes behind me contain stories from Albertans who step forward to say, "We stand with you." We're walking into negotiations today standing tall, because these messages are proof of what we at HSAA have known all along. Albertans value the people who care for them. Albertans like Joy, who writes, quote, "Keep strong. Your members provide an invaluable service to Albertans and deserve recognition for the integral nature of their work in helping people access medical services, get treatment, and recover their health." And Cameron, and he quotes, "This week my 85-year-old mother dislocated her hip. The care she received involved paramedics, nurses, doctors, x-ray techs, respiratory therapists, and many, many more. Their thoughtfulness, concern, and dedication to my mother and to their profession proves evidence." Or the message from Heather. "You deserve more than gratitude," she says. "You deserve financial compensation, fair working conditions, safe staffing levels, and the resources necessary to provide the level of care Albertans expect and rely on at their most vulnerable." And we couldn't agree more. At a time when 500,000 Albertans are on wait lists for care, our members give their all to provide excellent care with real compassion, unparalleled skills, and constant professionalism. On Monday, we released data showing that 82% of Albertans are worried about staff leaving these specialized professions. And they should be worried. When we talk about short staffing, these are not abstract numbers. These are people missing from the front lines of care. Advanced care paramedics have a vacancy rate of 12%. These are our first responders. There are so few of them that they are now working over 30,000 hours of overtime per month. We talk about the importance of mental health care and supporting those Albertans with mental health challenges. But how do we do that with a 13% vacancy rate for psychologists? We're short-staffed in mental health. We're also short-staffed in cancer care. Radiation therapists, the professionals who prepare and deliver the treatment that stops cancer and creates conditions for remission. 16.7% vacancy rate. That means less treatment for cancer every single day. And let this sink in. Our cardiovascular perfusionists, the folks who operate the heart-lung bypass machine, they are at a 22% vacancy rate. A reminder, there are 80,000 Albertans waiting for surgery. Meanwhile, we are short a full fifth of the people who keep patients breathing and keep blood flowing during cardiac surgeries. When you ask Albertans what the solution is, they are not shy about it. 81% of Albertans want more investment in public health care. 82% want action to retain and recruit these professionals. And 77% view fair wages, better benefits, as an important part of the solution going forward. What that says to me is that Albertans can see these long waits for health care for what they really are: an alarm bell, a siren. It's an emergency happening on the front lines. It is time to do more than restructure healthcare. It is time to invest in the people who deliver it. Across Alberta, our members are showing solidarity like never before. They are organizing local meetings, planning rallies, And today they're wearing blue to work for what we call Code Blue Wednesday. They're writing their MLAs. They're meeting with them face to face. Some of these messages are from healthcare professionals too. Here's a message from Val. Quote, I left permanent employment with AHS in May of 2025. I'm still a casual employee because I love what I do, but I am feeling defeated. Or Anne, who writes, quote, I'm a lab technologist, nearing 15 years in this profession, and I have never worked at full staffing. The thought of another 15 years is very daunting. The burnout is happening already. Or Megan, quote, I have been a member of HSAA and a respiratory therapist at the Stollery Children's Hospital for 20 years. Some days we literally run for the whole 12-hour shift, missing breaks and consistently being forced to function short-staffed. Something needs to change, says Megan. Well, Megan's right. Something does need to change. And that change needs to happen this week at the bargaining table. Our union is ready to bargain a fair deal that respects, retains, and recruits. Our members have spoken about what they need. They need a deal that values their care, and it keeps them here for the patients who need them. We are coming to the table in good faith today, with strength and purpose, because we believe in free and fair collective bargaining in this province. We are bringing these messages behind us to the bargaining table as well, in support of a deal that our members deserve. Thank you, and I'd be happy to take your questions.
I know you can't get into the specifics of negotiations, but are you able to illustrate how far apart or how close the parties are?
It's a great question, and I have to be very cautious right now because as we walk into formal mediation, we have agreed to embargo the conversation. This allows the two sides to have fruitful discussions. But I can tell you this, our members have been loud and clear that what they need in all of this is the strength of a collective agreement that retains the workers we have and recruits more. As I stated, we are in a global competition for workers. We need Alberta to be that shining light for healthcare that brings workers here to fill those vacancies. Those numbers are atrocious. We need the workers. We need those healthcare professionals, and we're in competition now globally to do it.
We've had a lot of these issues be known for years now, so why did you feel it was important to kind of do this initiative to further highlight that?
As I said in my opening statements, our members are at their max. They are struggling every day just to maintain the care that they provide. This is a boost to them to say, don't worry, your union is here, we are in it together, and Albertans are standing beside you. They support the work that you do, and they are demanding better.
You mentioned that currently in the current conditions, health professionals weren't able to give high quality cares. Do you have any concrete example of that where someone was in danger? Maybe?
Sure. The example that I will lean to is the fact that there are still 80,000 people on the wait list for surgery. We can't even move the patients in that are waiting now, not months for a hip or a knee. They are waiting years. And this is a tragedy in all of this, that people can't get the surgeries that they need. And again, 500,000 people on wait lists in the province. All of them are in need of health care, and they're not getting it because we don't have the people.
And are there some places across the province where it's more serious?
It all in context. Just recently in southern Alberta, obstetrics is closed again. In Fort McMurray, we have less access to imaging. Like, these things are going on all over the province in different factors. The numbers coming out on closed ERs across this province are devastating. The healthcare system is not available to Albertans in a way that they expect and deserve. And it's because we don't have the people. Thank you.
With teachers and nurses, going through their negotiations, do you find that maybe the government isn't giving you the right amount of time or effort in bargaining?
What I would say is this, is that our members deserve to have their voices heard at the bargaining table and not be silenced by legislation. This is dangerous times, and it's very alarming to see these actions that are going on. It is our workers' rights to be heard at that bargaining table and they need to start listening.
And if you're not heard, what will be the next steps?
Well, that's a great question, isn't it? When we talk about this, I need to reinforce that we are here to get a deal for our memberships that provides the respect for them. Our focus is on securing a better deal today. That's why we're going back to the table. Those next steps will have to remain to be seen, and we'll see what it looks like next week.
Last week we heard the AFL talk about, with so much discontent across industries, the possibility of exploring a general strike. And so I'm wondering if the union is in conversation with other unions to arrange that.
Yeah, I observed those comments as well, and I'll just tell you this again. Workers deserve to be heard at the bargaining table and not legislated back to work. We need to get through this process now. We support the challenge that the teachers have provided against Bill 2, and we're watching very closely, and we support the actions of labor in this province.
How difficult is it going to be for you guys to come to an agreement here? Because I know that in the fall, you had about 60% of your union members vote down a deal. That's not quite the 95% that we saw with the teachers there. So, I mean,
Yeah.
There's still some ground to make up there.
So two different votes, let's be real on what that looked like. One was an acceptance or a rejection of a collective agreement, and the other would be a strike vote. Two very different conversations. And probably two very different numbers. And we're not in that position today. Today we are looking for a deal that respects our members, recruits more, and keeps the ones that we have already.
Are there any concerns with finding a deal that works for all of the union members?
There is absolutely concern. This is high risk and high stakes right now. And I hope the other side's listening to this conversation and the conversation that started this morning at 9 o'clock in the Calgary meetings. They better be listening.
Just tying in the shoes behind you. Obviously, your members have been very vocal. Why bring in voices of Albertans to your cause?
In the struggles that they've been facing, it feels very isolating, especially in conversations where you're being drowned out by other announcements that have nothing to do with the system that is in crisis right now. This action is to support those workers on the front line to say, you're not alone. The public, the province, and the people that live and work here hear you, and they stand with you. That's what this is about.
Are you hoping that the government then hears the voices of Albertans in addition to your own when you go back to bargaining? Or is this more of a support for your members?
I am very comfortable that the government is hearing from these people as well, because that was part of our campaign. And as I stated, there are people out there who have the courage to go meet with their MLAs to say stuff is wrong, you need to fix it. And that's the conversation that's happening. This was to show our members that we are supported in our actions and our conversations, and it's a very significant percentage of Albertans that say, we support you.
You mentioned several times short staffing. I think you might rely on immigration workforce in this category of job. What do you think of the current numbers, the current trend of limiting immigration?
When you look at immigration stats and federally or provincially, these are different conversations than a bargaining table, obviously. What we're talking about here are healthcare professionals, and right now, in a global conversation, they are competing all over the place. The U.S. is always in Canada looking for healthcare workers. The East Coast and West Coast are always out there providing better compensation for the work that we do. And so when you're a worker, you make a decision and you walk. What I'm saying here is that Alberta's got an opportunity to make this the shining star of healthcare, not only in this country, but on a global scale. And that workers across the world would consider applying here and coming to Alberta to provide their care. Regardless of how many people move in, we don't have the professionals that are coming here. That's the risk we face.